We are with Representative Lillian Ortiz-Self from the 21st District. This is the end of the first week of session, and I understand that you have been extremely busy, but I wanted to ask you specifically about how the session is being carried out completely remotely, but originally you were going to be hybrid. So what happened?
We had been planning all through interim to be in person, and then we had to switch to hybrid, and then now we're doing virtual session. As you know, Omicron has thrown everything for a loop, and as those number of cases have increased, we had to think about the safety of the public and the safety of our members. If we don't have the members to vote, every bill dies and we have to shut down, and we have 60 days to get this work done. So we have to be here, and we can't afford to lose our members because then the process stops. So unfortunately, that's been the case. However, the good part of all of that, we have so many more constituents, so many more people have access to us now. We are learning the benefits of being virtual is that someone in Spokane can call and testify and give a 3 to 5 minute testimony without taking a whole day of work off. And we have heard from people last year that we have never heard from before, and we already have started off this year the same. So the exciting part of this is that we get to hear from people we never had heard of before.
Now I want to ask you about a couple of your priorities, and let's start with House Bill 1746. What is this bill about?
Yeah, so as you know, I am a school counselor, and what is happening in our school system and in our mental health system, as a mental health counselor as well, I'm very interested in and live out on a daily basis. And this bill is about looking at all the adverse factors in our communities and how they've been affected. I think after a year and a half of this pandemic, we owe it to look at our systems and see what is working and what is not working and where are the gaps. In the last 10 years, we've implemented things like social emotional learning, been able to implement a data system that disaggregates our data. And now we are living through the pandemic and have given so many dollars into our school system, into mental health. We've invested in our communities, but we have to be able to evaluate and see what's working and what is not working and where the gaps are. And that is what this is going to give us so that we can move forward in the right direction.
In your time in the legislature, you have worked really hard to increase diversity in all sorts of areas, but specifically in education, and to fight for equity. And I think you have a bill for community colleges. Is that right?
One of the other issues is making sure that we have equitable services across our systems. And our community colleges have, for a while, been left behind. And we've made some investments in it in the last couple years with the College Workforce Act. And we need to make sure that we bring that full circle. So one of the things that we've noticed is our community and technical colleges, unlike many of our four-year universities, the mental health services are lacking. Some community colleges had no mental health counselors at a time when we need it the most. And so we are looking at increasing some of the pilot projects that would include putting in mental health counselors in our community and technical colleges, as well as look at multiple needs in our community and technical colleges around staffing, around wraparound services and services for our students, around retention, and increasing equitable outcomes for our students.
Any specific message for people in your district?
Absolutely. For my district and for the state of Washington, I want to say that as I have traveled and as the stories have come in, I have heard from all of you the cost of living, the impact of this pandemic. It's been hard across the board, across so many areas. And I've heard that, we've heard that, we're moving forward in trying to address a lot of those issues. So I guess I'm asking everyone else to just hang in there, to keep helping each other, to keep showing the compassion I know my district is very capable of doing. And I do believe that together we're going to get through this.